Welcome to Psych Talk. I'm your host, Dr. Jessica Rabin, a licensed clinical psychologist. If you are a mental health professional, student in the social science field, or just interested in psychology and mental health, this podcast is for you. Although topics discussed on this podcast are similar to therapy, Psych Talk is not a replacement for therapy and is for educational and entertainment purposes only. So let's dive into today's episode. Once we stop letting our thoughts automatically control our behavior, we can make far better use of our own cognitive talents. Hey everyone, welcome back to Psych Talk, and thank you for joining me for today's episode. The quote I just read is from Dr. Stephen Hayes, who is the founder of acceptance and commitment therapy, otherwise known as ACT, which is what I'm going to be talking about in today's episode. So over many years of doing this podcast, I have identified themes among episodes that tend to be more interesting to listeners. One of those themes is intervention-based episodes, which makes sense given that many of my listeners are in the mental health field, plan to go into the mental health field, or have a general interest in mental health. For example, two of my most listened to episodes of all time are episode 136 on inference-based cognitive behavioral therapy with Christina Inabe and episode 45 on radically open dialectical behavioral therapy with Lauren Root Martin. More recently, I had Elizabeth Abruzet on episode 225 talking about emotional transformation therapy, and Dr. Kiki Failing on episode 231 discussing dialectical behavioral therapy. As this podcast would be nothing without you all, I always want to ensure that I am covering topics that are of interest to you. So I decided to do an episode on ACT after attending a recent continuing education presentation on it, and because it's something I haven't talked about before on this podcast. I've talked about values a lot, which you will see in this episode is a large component of ACT and something I utilize a lot in my clinical practice, but I actually haven't done a full episode on ACT. So I do want to be fully transparent before diving into this episode. ACT is something I learned in graduate school. It is also something I will utilize with some of my clients. And as I just said, I also recently attended a continuing education seminar on it. However, I would not consider myself an expert in ACT. And thus, my goal of this podcast episode is really to give a basic overview of what ACT is. So if you are in the field, it's probably going to be a refresher. And if you are not, you may learn the basics of an intervention you may not be familiar with, but this is definitely not going to be a deep dive. But if you enjoy this episode, enjoy the basic overview of ACT, I definitely will encourage you to look into more information about ACT. I'll put some links in the show notes as well for more resources that you can find beyond this episode. So first, I'm going to just briefly go over the history of ACT. So ACT was developed in the 1980s by Dr. Stephen Hayes, a professor at the University of Nevada. The ideas that eventually developed into ACT emerged from Hayes's own experience, particularly his history of panic attacks. Eventually, he vowed that he would no longer run from himself and he would accept himself and his experiences. So, ACT is an action-oriented approach to psychotherapy that stems from traditional behavior therapy and cognitive behavioral therapy. It's considered a third wave CBT. Within ACT, clients learn to stop avoiding, denying, and struggling with their inner emotions, and instead accept that the feelings that they are experiencing are appropriate responses to certain situations that should not prevent them from moving forward in their lives. With this understanding, clients begin to accept their hardships and commit to making necessary changes in their behavior, regardless of what is going on in their lives and how they feel about it. So the ACT basics, the very basic fundamental components of ACT include accepting thoughts and feelings, commitment to valued life directions, taking action, and this idea that all humans experience pain. So this is something that we do not want to feel. And our attempts to solve the problem, AKA we're ignoring or avoiding the pain, is often the problem itself. We engage in behaviors to avoid pain, but then the behaviors we engage in often become the problem. So, examples of this, a lot of people will use substances to cope with their pain. So, the substances will numb the pain. So, we're avoiding or ignoring the pain, but then substance use becomes a problem within itself. We also see this with eating disorders. We see this with any type of avoidance behavior. I always tell my clients that avoidance feels good in the short term, but in the long term, it causes more problems. And so, if we think of this idea that all humans experience pain and we recognize that our avoidance behaviors are actually causing more harm than good, we need to take an alternate approach, which ACT teaches us to do. So, as of 2024, ACT has surpassed 1,000 randomized controlled trials and is considered an evidence-based intervention for a variety of conditions, including but not limited to anxiety, depression, OCD, psychosis, and chronic pain. So it can definitely be used for a variety of mental health conditions. I also think ACT skills can be applicable to people that may not meet criteria for a mental health condition, but are experiencing some type of stress, overwhelm, avoidance of certain thoughts, feelings, and behaviors. So, at the core of ACT is this concept of psychological flexibility. ACT begins with the fundamental understanding that pain, grief, loss, disappointment, illness, fear, and anxiety are inevitable features of human life. Thus, the goal of ACT is to not eliminate or suppress these experiences, rather, develop psychological flexibility so that individuals can pursue valued life areas and directions. So, what is this psychological flexibility thing that I am talking about? Psychological flexibility is the ability to feel and think with openness, attend voluntarily to your experience of the present moment, and to move your life in directions that are important to you, building habits that allow you to live a life in accordance with your values and aspirations. It's about learning not to turn away from what is painful and instead turning towards your pain in order to live a life full of meaning and purpose. So, in other words, psychological flexibility is the capacity to adapt to difficult experiences while remaining true to one's values. Psychological flexibility is the opposite of psychological rigidity, which is an inflexible and unhelpful way of thinking and behaving that can lead to suffering. So, psychological rigidity can manifest in many ways, and I'm going to go through a variety of ways that it does manifest because I think this is important before we jump into the six main components of ACT so that you can see the contrast between psychological rigidity and psychological flexibility and how the core components of ACT can help us get out of psychological rigidity. So, the first way that psychological rigidity may manifest is through what we call experiential avoidance, which means you are trying to get rid of or avoid unpleasant thoughts and feelings. Thus, the focus is on getting rid of problems and pain rather than facing them, which can lead to a cycle of suffering. What we know about avoidance is that it helps in the short term. I just mentioned that a few moments ago, but it is harmful in the long term. So, in an effort to shut down feeling pain, we are also shutting down feeling anything. Many people may experience this as feeling numb. So, we avoid feeling pain, but in turn, we also realize that we can't experience things like joy and happiness. Another way that psychological rigidity may show up is what we call cognitive fusion. And this is a state in which our thoughts exert excessive influence over our physical actions and awareness, often to a problematic degree. So basically, we are our thoughts and we are unable to separate ourselves from our thoughts, which may lead to being self-critical, rumination, which is just thinking about those same negative thoughts over and over and over again, or cause painful memories to arise that confirm the negative thoughts. Next, we have inflexible attention. And this may show up as distractibility, disengagement, and disconnection. So I'm going to break down all of those. So, distractibility pertains to the challenge of maintaining focus on a particular task or activity. The more distracted we become when trying to complete a task, the poorer our performance is on that task, and the less satisfying the experience is. Disengagement involves losing conscious interest or engagement in our experiences, such as going through the motions, acting mindlessly or as if we are on autopilot, or displaying boredom, disinterest, and absent mindedness. And then disconnection refers to a lack of conscious awareness of our own thoughts and feelings. When we lack self awareness of our thoughts and emotions, it makes it difficult to modify our behavior in adaptive ways. This may also lead to emotional dysregulation or impulsive or reactive behavior. Another way that cognitive rigidity may manifest is by us having unknown values or feeling distant from our values. So, as our behavior becomes more driven by fusion and experiential avoidance, our values often become overlooked, neglected, or forgotten. When we are unclear on our values or are unable to connect with them, we cannot effectively use them to guide our behavior, which I'll be talking about more here when I get into the six core components of ACT. Cognitive rigidity may also look like unworkable action. So, this refers to the behavioral patterns that lead us away from living mindfully and in alignment with our values. This may manifest as impulsive, reactive, or automatic actions rather than mindful, deliberate, or purposeful ones. Some concrete examples of unworkable action include drug and alcohol abuse, social withdrawal, anhedonia, so loss of interest or pleasure in things that we previously enjoyed, excessive sleeping, excessive TV, gaming, or social media consumption, as well as suicide attempts. And then lastly, cognitive rigidity may present or manifest as fusion with the self concept. So, what I mean by this, humans are complex human beings with multiple layers. However, when we fuse with our self concept, we have a very oversimplified self and lose our identity. For example, we may perceive ourselves in terms of simple and overgeneralized words such as bad or worthless or unlovable. When we oversimplify ourself, we have difficulty defining who we are and what our goals are in life. So now we're getting into the bulk of the episode. I wanted to talk about psychological rigidity before diving into the next section, which is talking about ACT's Hexa-Flex. I can link in the show notes what a Hexa-Flex looks like to give you a visual, because I can't really describe it, but Hexa-Flex, there's 6 sides. And each point has a one of the core principles of ACT. But it's important to know, like I said earlier, about psychological rigidity because it is the opposite of psychological flexibility, which is one of the main goals of ACT. So, as a reminder, ACT is a third way cognitive therapy that focuses on accepting symptoms as they are while also working towards value driven goals, with one of the main goals being psychological flexibility. A hijacked Hexa-Flex is psychological rigidity. And this occurs when someone is struggling with a mental illness. So, as I go through each of the core principles in the Hexa-Flex, I will then at the end identify the psychological rigidity construct that contrasts that, which you should be familiar with based on what I just described a few moments ago. So, like I said, Hexa-Flex, 6 sides, there's 6 core components of ACT. So, I'm going to go through all of them now. The first one is contact with the present moment. And so when we say contact with the present moment in ACT, we are talking about practicing mindfulness. So mindfulness means observing your thoughts and feelings without judging them or trying to change them. A common misconception about mindfulness is that it means you are silencing the mind, But this is not true at all. Mindfulness is not about silencing the mind, it's about noticing the mind and what is coming up in your mind when you're being present. So once you get to know your mind, it becomes very predictable. What do I mean by this? Part of mindfulness is getting to know the uncomfortable things that the mind does and become more prepared. So, for example, if you pay attention to your mind and notice a pattern of whenever something goes wrong, you start getting stuck on the thought. Your instinct is to blame yourself. You notice that you're very self-critical, even if the thing that happened that went wrong is out of your control, you somehow find a way to blame yourself. That is the predictable pattern. So if something goes wrong, you're going to blame yourself. Mindfulness then teaches you how to move your attention from thought to thought and not get stuck on that thought. So if you know you're always going to engage in self blame when something negative happens, instead of getting stuck on that thought or ruminating or over analyzing that thought, mindfulness allows you to move past it because you know it's a pattern that your mind engages in. Okay, something bad happens, I'm going to blame myself. It doesn't mean I am to blame. It just means that that is what my mind does. But now, since I've recognized this pattern, I can move on and focus my intention elsewhere. Mindfulness also helps us stay in the present moment and minimize distractions. So, through mindfulness, we also become acquainted with sensory experiences in the moment. We learn how to move our attention to and from thoughts. And this takes practice. It's a lot easier said than done, but that practice is mindfulness, being in the present moment and sitting with your thoughts, feelings, experiences without judgment. So, the cognitive rigidity concept in direct opposition to being in the present moment would be being anywhere but present, living in the past and fearing the future. And doing either one of these is where anxiety lives and fear and flourishes. So if we are always thinking about the past, we're worried about past things that we have done, said, etc. If we are always living in the future, we're worrying about anything that could possibly happen. So we're not being mindful, we're not being present. However, by being in the present moment, we can experience events clearly and directly, which can help promote behavior change. So, the next concept and act that we're going to talk about is cognitive defusion. So, it's DEFUSION. And earlier we talked about cognitive fusion, and I will talk about that here at the end. So, when you are fused with your thoughts, you feel you are your thoughts. Defusion teaches you that thoughts are just thoughts. So, the whole point of defusion is to get space from that thought. Years ago, in the psychiatric hospital that is attached to the hospital I work in, I was in a meeting there, and there was a big sign in the room that we were in. And it just said, a thought is a thought, and thoughts can change. And that is really the core concept of cognitive fusion. Yes, a thought is just a thought, and thoughts change. If we try to stop and analyze and think about every single thought we had each day, it would be absolutely impossible to function because we have so many thoughts that are fleeting. Some thoughts just pop up randomly, some thoughts are triggered by a certain incident or smell or image, etc. So, with cognitive diffusion, it teaches us to step out of the context and recognize the thought as just a thought. It teaches us not to give into thoughts as commands, and it teaches us to give attention away from the thoughts. So, some techniques used for cognitive diffusion. First, getting to know your mind. And that's what we were kind of doing with mindfulness. We are sitting in the present moment and getting to know our mind. So identify what your mind is doing and categorize it. So another technique that is used in ACT is called name the story. So name the story based on what your mind is doing. So if you notice like you're having all these thoughts about whatever it is, and you identify the theme coming up is that, oh, I just could have done better. Um, you know, you feel bad on yourself, you're down on yourself, you're being self-critical, and you realize the underlying theme is, I just felt like I didn't perform as well as I could have. I could have done better. Name the story. The story is now the I could have done better story. And it takes the emotion out of the thought, and you are getting that distance from your thoughts. Another simple intervention is just naming it as I am having the thought. So instead of if the thought is, I'm a horrible person, you just add, I am having the thought that I am a horrible person. This separates the individual from the thought and gives space to the thought. So instead of being fused to the thought of I am a horrible person, you are stating, I am having the thought, I am a horrible person. Another technique, and I use this one a lot with my clients, is helpful versus unhelpful. So rather than asking yourself, is the thought true or not? Because sometimes true thoughts are unhelpful, or true thoughts are still negative or uncomfortable. So asking if the thought is true or not is not always helpful. But you can ask yourself, is this thought helpful or unhelpful? Because we can have accurate, true thoughts, but they can also be unhelpful. And it doesn't serve us to ruminate on those thoughts or be fused with those thoughts. You can also ask yourself, is the thought leading me in the values driven direction I want to go? And I do a kind of spin on this a lot with my patients who have eating disorders. I'll ask them, when you give in to your eating disorder voice, or when you are listening to your eating disorder voice, or let your eating disorder voice take the steering wheel and drive the ship, is that leading you into a direction towards recovery or whatever your goals are? Or is that leading you away from it? And another way to separate yourself from your thoughts is think of your thoughts, especially those that we're trying to separate ourselves from, because we obviously have some positive thoughts that we probably don't really mind or need or want to get space from, is thinking of these thoughts as doom and gloom background radio. So thoughts can be background music. But depending on the relationship with that thought, it may pull your attention in and you might focus on the thought. So maybe like the radio, like your favorite song comes on. Or, if we're thinking of the doom and gloom kind of metaphor, maybe there's something like really shocking about the lyrics, or like the sadness of the thought just pulls you in. But diffusion allows that thought to be in the background. So you're playing the background music, it's still there, it still exists, but you are not focusing on it. So to kind of wrap this all up, diffusion gives us space from our thoughts and allows us to make choices about what to do or not to do with that thought because we have that space. So the cognitive rigidity concept that would go directly against cognitive defusion is cognitive fusion. So this idea that I am my thoughts, or if I feel that my thoughts are true, that's all that matters. So the next concept we're going to talk about is experiential acceptance. So acceptance involves acknowledging and embracing the full range of your thoughts and emotions rather than trying to avoid, deny, or alter them. So, learning not to run and avoid everything, learning not to run from and avoid everything that is uncomfortable. So, as I mentioned earlier, the discomfort you are running from is likely causing you more discomfort, or the way that you are running from the discomfort is causing more discomfort. So, put in the most simple terms, experiential acceptance can be summed up by the phrase, it is what it is. Acceptance does not mean liking or approving of whatever is going on. It means you are practicing non judgmental awareness of both internal and external events. So, ACT likes to use a lot of metaphors. And I know I said at the beginning, like I learned about ACT in grad school. I utilize it a lot with my clients, actually, at least certain components of it. One thing that prohibits or prevents me from using ACT a lot more than I do is its use of metaphors, not because I don't think metaphors are great. I think they are. I just personally think I'm very bad at metaphors. And like I am so like logical and rigid in a lot of my thinking that metaphors, I can read them, I can give them. If I've learned them, I can do it. I am not the type of person that can just come up with a metaphor on the spot. So I am going to share with you all some of the metaphors ACT uses to talk about experiential acceptance, but know that none of these are my own. And I will be reading while doing this podcast episode for these because if I tried to just go off by memory, I would probably mess them up. So the first metaphor is quicksand. So if you get stuck in quicksand, the instinct is to fight. However, if you do this, you will be stuck in. You will be sucked in further into the quicksand and it will be harder to get out. The only way to get out of quicksand is to accept where you are, remain calm, breathe, and float to the top. So the quicksand in this metaphor is our thoughts. If we have all these negative thoughts and we just want to fight them, if we want to challenge them, change them, we are just going to start ruminating on them a lot more. So the only way to get out of it and to live a value aligned life is just to accept that this is the current situation, this is what's going on, and then we can float to the top. It doesn't mean the quicksand's not there, but it's not sucking us in more. Another metaphor is drop the rope. So you are on one side of the rope in a tug of war with insert any mental health concern here. But for this example, we'll use depression. There is so much energy put into that fight and ACT, especially experiential acceptance, will teach us to just drop the rope. Instead of being in a tug of war with your depression, you just let it go. Depression is still there. They are still on the other side of the rope, but you are no longer in a fight with it. This is not avoidance. I want to make that clear. It's power and strength into what you put your time into. So you are no longer putting your time and energy into this tug of war with depression. You are actively choosing to drop the rope, to stop that fight, and then turn your time and attention into the things that matter most to you. Then we also have demons on the boat. So in this metaphor, the boat represents our journey through life. And the demons symbolize the difficult thoughts, emotions, or experiences that we encounter along the way. These demons can include fear, self doubt, anxiety, or any other form of psychological distress. So, the initial reaction when faced with these demons might be to fight against them, try to eliminate them, or avoid them altogether. However, ACT suggests a different approach. Instead of engaging in a constant struggle with the demons, ACT encourages individuals to acknowledge their presence, accept them as a natural part of the human experience, and make room for them on the boat. Being able to observe and accept the presence of these difficult experiences without judgment or resistance, so that's the mindfulness component, while still choosing to take actions that align with one's values and goals, is the way we can develop psychological flexibility. In the metaphor, the focus is not on getting rid of the demons, but rather on learning to navigate the boat despite their presence. By acknowledging the demons, accepting their existence, and choosing to take actions that move us in the direction of our values, we can learn to live a meaningful, fulfilling life, even in the face of challenging experiences. So, acceptance allows us to live despite our painful thoughts and feelings and emotions, and not live a life directed by them. So, we are thinking about cognitive rigidity instead of cognitive flexibility. The opposite of experiential acceptance is avoiding experiences or experiential avoidance. So, avoiding any and all things that may be uncomfortable. And so, the way I explain this to clients a lot of times, just put in the most simple terms, like we can hold both things at the same time. Pulling a little DBT here, like two things can be true. You can be struggling with anxiety and you can still live a life that aligns with your values. You can have these self critical, depressive thoughts and still live a life that aligns with your values and moves towards your goals. So the next concept we're going to talk about is self as context. So self as context is an idea that expands on the notion of self and identity. It purports that people are more than their thoughts, feelings, and experiences. It is the process of contacting the observing self, which is the part of us that we are able to witness our thoughts, feelings, and actions. And so, in other words, the observing self is the part of yourself that has the ability to zoom out on yourself and observe. This part allows you to be mindful when we practice getting in contact with our observing self, and we are able to let go about previously held beliefs we had about ourselves. So, a metaphor used in ACT for self as context is the stage show. So, think of your life as a stage show. On that stage are all your thoughts, feelings, memories, and everything that you can see, hear, touch, taste, and smell. The show is changing all the time. If you have ever been to the theater and watched a live performance, you know there are so many moving parts. The observing self is that part of you that can take a step back. So you are now in the audience and watch the show. You can zoom in and take in all the detail, or you can zoom out and take in the big picture. Another metaphor used is the sky and the weather. So you and your observing self is like the sky. Thoughts and feelings that you have are the weather. The weather changes continually, but no matter how bad it gets, it cannot harm the sky in any way. The mightiest thunderstorm, the most turbulent hurricane, the most severe winter blizzard, these things cannot hurt or harm the sky. And no matter how bad the weather, the sky always has room for it. And sooner or later, the weather always changes. Now, sometimes we forget the sky is there, but it is still there. And sometimes we can't see the sky, it's obscured by clouds. But if we rise high enough above those clouds, even the thickest, darkest thunderclouds, sooner or later we'll reach clear sky, stretching in all directions, boundless and pure. More and more, you can learn to access this part of you, a safe space inside from which to observe and make room for difficult thoughts and feelings. So, in sum, being able to zoom out allows us the option to zoom in on the life we want. When we zoom out, we can determine if we are leaning into a life directed by our values. And if we determine we are not, we can take steps to change that, which I will talk about here shortly. So when we think of cognitive rigidity instead of cognitive flexibility, the opposite of the observing self is the oversimplified self, where we have a lost identity and are holding all past chances and dictation of your identity. So the fifth concept we are going to talk about is values. And values is probably my most favorite part of ACT and something I use with many of my clients, even if I'm not doing a full ACT protocol. Values, put simply, are the things that matter most to us in life. There is an activity we do in ACT called the values card sort, and I will link some cards in the show notes. But in brief, you get a deck of cards that has various values written on them. So, like one value per card. Then you sort the cards into piles of very important to me, and not important to me. After you have sorted all the cards, you get rid of any cards in the not important to me and important to me categories and just focus on the very important to me values. Then you narrow down this pile to the top 5 to 10 most important values to use. The purpose of this activity is to help clarify our values and reflect on what is truly important to us. So I already said that values are the things that matter most to us in life. They are also how you want to behave in life, the way you want to interact and relate to the world, other people, and yourself. They describe what you do and how you do it. And values are about ongoing action, which brings me to what values are not. Values are not goals, they're not feelings, and they are not others' expectations of you. And I really want to highlight that because when you're doing the values card sort, it's supposed to be a gut reaction to the values. It's not supposed to be what you feel like you should care about. So, an example I always give, because I've done the values card sort over years. When I first ever did it when I was in grad school, I remember coming up on environment. And I remember thinking, like, I know I really should care about the environment. I know this should be one of my top priorities, but it's not a top value of mine. That doesn't mean I don't care about the environment. I absolutely do. And if I'm thinking of my top 5 to 10 values, it didn't fall in there. And I was shoulding myself, which is something we talk about a lot in like CBT or EBT, that you don't want to should on yourself because should doesn't allow for that flexibility. So values are not what others expect of you or what you think you should care about. So in ACT, when you're doing values work, first you identify your values via the values card sort that I just described. And after identifying your values, you identify behaviors that align with those values. So as an example, say that one of your top values is creativity. You will identify behaviors that you engage in that align with the value of creativity. Maybe doing art, and maybe dancing, home renovations, etc. Similarly, if one of your top values is honesty, you would identify behaviors that you engage with that align with that value of honesty. When you know your values become your anchor in life. However, when we do something that goes against our values, it feels off because it doesn't align. So, going back to creativity, if this is a value of yours, but when you reflect on your behaviors that align with the value, and you realize that you have not had a creative outlet in months, you may be able to tie that to a lower mood or feeling stuck or having writer's block or whatever it is. I tell people all the time that when we live out of alignment with our values, of course our mood is going to be impacted because we are not living a life that involves doing the things that matter to us most. For a more concrete example, if you value family, but you haven't spent time with your family in months and haven't called them or texted them in weeks, you are probably going to feel worse than you do when you are actively engaging with them. When talking about values, another concept that we talk about a lot in ACT is what's called the big lie. And this is a lie that our mind tells us that you can live the life you want to lead while holding on to, quote, a little bit of your depression, anxiety, eating disorder, substance use, etc. I see this a lot in my work with eating disorders, with individuals who believe they can be happy, live the life they want, while still holding on to a little bit of their eating disorder. Like, oh, I won't restrict as much, but I could still restrict a little bit. And I want to be clear. I am not saying you can have a fulfilling life while also experiencing depression, anxiety, substance use, eating disorders, etc. Go back to that metaphor about dropping the rope. You can coexist with those things. However, if the mental health condition is the driver in your life, it is likely that you are not living a life in alignment with your values. But when your values start taking the lead and you engage in committed action, which we will talk about here in a minute, to live a life in alignment with those values, naturally the mental health condition does not have room to be the driver. It does not mean it's not still there or that you don't struggle, but you are no longer fused to the thoughts that your depression, anxiety, eating disorder, substance use, etc. tells you. So ACT is about growing the healthy self so that less of yourself is taken up by those unhealthy behaviors. Once you know what your core values are, you are able to focus on the life that you want and how to get there. So, if we're thinking of cognitive rigidity, which is the opposite of cognitive flexibility, the opposite of known values is unknown values. So, this would look like following what your depression is telling you, your anxiety is telling you, your eating disorder is telling you, um, following their rules, following their guidance, and then believing in the big lie that you can still live a life in alignment with your values, a fulfilling life while holding on to a little bit of that. And I also want to make it clear because I don't want people to take away like, are you saying that I can't be successful or happy while struggling with depression? I already said this, but I want to reiterate again. That's not what I'm saying. It's more that the big lie is you're actively choosing to still hold a part of whatever that mental health condition is because it feels comfortable and safe. So, and I see this a lot, like especially with eating disorders, that even if people want recovery, they're scared to recover because their eating disorder has taken up so much time, space, has isolated them. In many instances, people describe it feeling like a friend, even though they know it's harmful to them. And it's scary to give that up. And that is a very valid feeling and experience. So the big lie is if you're actively choosing to hold on to these things that you know are harming you and trying to live that value aligned life while actively holding on to things that drive you away from it. So I hope that clarified that. And then the last tenet component of ACT is committed action. And so this is the sixth concept in the Hexa-Flex. And committed action is the process of taking steps towards valued goals by incorporating changes that will align with our values and lead to positive outcomes, even if we are experiencing uncomfortable thoughts and feelings while doing it. So, first, we have to reflect on the question, what am I willing to do? So, it is only committed action if we are actually willing to do it. Even if it is small, it is worth starting. I tell people all the time if you want to live a life in alignment with your values, like, yes, it would be great if you're doing these giant things every day, but it's the small, tangible things that you can incorporate into your daily life that are going to add up overall. Next, we need to ask, is it in my control? Because it doesn't matter how much you want something. If it is not in your control, you cannot change it. So if we go back to the value of family, if you wish your mom would call you more, you can communicate that to her, but you cannot make her call you because we cannot control other people's behavior. So reflect on things that you can do within your control that align with your values and make those actionable steps. So in ACT, we have something called the ACT matrix. This matrix is constructed with the intent to help guide people along the path of action. As this podcast is audio only, I will include a link to show you the matrix if you are interested in looking at one, but I'm going to try my best to describe it here. So basically, it's a 4-quadrant diagram. And then in the bottom right quadrant, you list your chosen values. So who and what is important to you. In the bottom left quadrant is where you create a list of internal experiences that might pull you away from those values. So those might be like difficult thoughts or emotions. You can ask yourself, like, what unwanted stuff shows up inside of me and gets in the way for living out my values. The top left quadrant is then filled with physical manifestations of the items in the quadrant beneath. So things you physically do that pull you away from those values. So these are like the avoidance behaviors, so to speak. And then at the top right quadrant, we would have a list of actions that draw you closer to your values. So, like, what could you do to move towards who or what is important to you? So, in short, on the right side, it's the things that align with you. And on the left side, it's the things that don't align with you. On the bottom of the quadrants, both right and left, are the more mental experiences. And on the top is the physical experiences. So it can be hard to think of a matrix in your mind, but like I said, I will link an example in the show notes, but that is the basic premise. It's just a tool to help people reflect on their values, what is keeping them from living a life in alignment with those values, and then how they could actually live out those values. So if we aren't taking action, then we aren't moving to or in the life we want. So through doing this, through committed action, the individual learns how committing to the valued action rather than the outcome can bring greater vitality. So when we think of cognitive rigidity rather than cognitive flexibility, the opposite of committed action is no action, where we feel frozen in uncertainty or desire for complete comfort before we move. And I want to, expand on that for a moment. Many of us don't want to take risks until we feel completely comfortable. But the reality is, we're rarely ever going to feel completely comfortable before doing something new. So identify your values, figure out ways that you can live out those values via small actionable steps, and start taking those steps today. So in conclusion, as we've come to the end of the podcast, ACT aims to develop and expand psychological flexibility, which encompasses emotional openness and the ability to adapt your thoughts and behaviors to better align with your values and goals. Rather than fusing with or suppressing uncomfortable emotions and thoughts, ACT teaches us to coexist with them while being driven towards value-aligned goals. So I think that's all I have for you today. Thank you for joining me for this episode of Psych Talk. If you want to learn more about ACT, I will have some resources in the show notes. If you enjoyed this episode, please share it with a friend, and I will catch you in the next episode. Bye. Thank you for listening to today's episode of Psych Talk. Please rate, review, and subscribe to the show. And if you enjoyed today's episode, please share it with a friend. Don't forget to follow me on all socials at Jessica Lee, PhD, and the podcast at Psych Talk Podcast on Instagram.